But you can go ahead. I still have about 3 minutes. Okay, we still have 2 more minutes. We have a minute and few seconds remaining until we start. So this is the time for you to tag your friends and then tell them that we are about to start. All right. Okay. Hmm. Okay, so we have just a minute more. A minute more. Okay. Hi, Dr. Edidiong. I can see you. How are you doing? Thank you so much for doing this. Thank you. 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 So we'll be starting in the next couple of minutes, seconds, yes. And I know that as we started, yes, it's 8 p.m. So people will start joining us. And then some people send me message that they are going to watch the play, either they are still on transit or something. But here we are. Okay, so good evening, everybody, and welcome to iCare Online. This is a rebranded and a relaunch of iCare Online. So it's going to be called the first episode of this segment of iCare Online. And today we'll be having understanding glaucoma. All right. Now, the plan is that every month we'll be having a guest speaker. I used to tell you guys that I have what just happened. Okay, that I have partners all over the country, different clinics I partner with. So most of them, their CEOs or their chief medical officers will be with us once a month to take us on a particular topic in the eye. So since this month is Glaucoma Awareness Month, we'll be talking more about glaucoma, and then I have an amazing young man. The guest speaker for tonight is going to be digesting everything about glaucoma for us. So all those questions, I have some of them here. We are going to be answering them all in the course of tonight's discussion. So if you're just joining my page in the past couple of weeks or months, I think it's been a long time since I did live like this. My name is Dr. Doris-Optometrist. I am an optometrist and eye health is my passion. So this page is dedicated to all things eye health, both here on Facebook, Instagram, TikTok, Twitter. It's all about eye health. And then I try to bring in a little bit of motivation. Now, the reason is that the eyes are really one of our most precious organs, right? So the best thing we can do is to take care of them, to love upon them, to know how best to cater for them. So basically, that's what this page is all about. So once in a while, you're going to see motivations and all that, but please just know that it could be one of my team and not me. The main thing I talk about is the eye care. I work here in Akwa Ibom, that's where I am, but of course, I have friends all over the country that also support what we do, which is to bring eye care to you, to bring quality eye care to you. So tonight I have an amazing guest because I know that I'm not going to be talking much. So he's gonna be talking, doing most of the talking. He's gonna be taking us through glaucoma and everything about glaucoma. So if you are watching this live, I would like you to kind of say something. Let me know if you can hear me, if you can see me very well. And then if you are watching replay, please kindly put a hashtag replay, drop your questions or your comments or your contribution so that we know how best to answer them. So the young man that I'll be having this tonight's episode with is Dr. Edidiong Udom. Dr. Edidiong Udom has 15 years experience in primary eye care optometry. He has 20 years experience in ophthalmic industry. He started as an optical lab technician and then he became an optometrist. He trained both in India and then in Nigeria. He is the founder of CJ Foundation, under which he had provided free eye care and cataract surgeries to rural communities all around Nigeria. He is the immediate past chairman of Nigerian Optometric Association Akwa Ibom State Chapter. He is currently the chief medical director of Magna Eye Care, a premium clinic located at number 2 Ado Ekiti Close off Emeka Anyoku Street, Gariki, opposite Alliance Hospital. He is married to my friend Imi Udom, and then they have 2 kids. Now I'm talking about an amazing man. Like when I talk about when I have cases that okay, let me see if I can bring him on board. Well, yeah, let me send him an invite. Okay, so that he can join us soon. Cases like we don't know it all, right? When I have cases that I don't know or I don't know what to do, this is one of the few people that I reach out to. Yes, that is the address of his clinic right down there. If you are in Abuja and you have any eye issue, this is one person that I can tell you that can take care of your eyes. So Dr. Ediddiong, I've sent you an invite and I hope you accept the invite and join us soon. So if you're joining us right now, we are talking about glaucoma, all right? And in the course of the discussion, Dr. Ediddiong is going to answer a couple of questions for us. You're going to be telling us what glaucoma is. You're going to tell us how it's developed and also how one can handle himself, if you happen to have glaucoma. So the thing is that even if you don't have glaucoma or you have someone that has glaucoma, you can actually advise that, hey, there he is.
Hello.
Hi.
Can you hear me?
I can hear you very well, very well. You can hear me, right?
Okay. Yes, I can hear you loud and clear.
That's awesome. All right,
Yeah.
so welcome. I just finished reading your amazing CV. I just finished talking about all the things. Man, guy, this is loaded though. See me, I'm intimidated. But you know what?
Yes, it's gonna be a very loaded evening tonight. I can assure our guests of that. Very loaded.
Yes, I love that. So, Dr. Ediddiong, we are talking about glaucoma because like next week is glaucoma week, right? And as optometrists, it is our job to educate the people and also to create awareness on the prevalence of this avoidable disease. So tonight, I will hand over the microphone to you. We are going to be talking about glaucoma, the disease itself, management, and then I have some questions that people usually ask, which borders around how it's developed, how one can contract it, and then how it can be cured. So I hope that in the course of the discussion that we're going to be having tonight, we'll be able to address that, right?
Okay. Awesome.
All right.
We've been prepping for this for a while, so we are ready to kick the ball rolling.
Yeah.
And by the way, thank you so much for having me. You have such an amazing community here. I was amazed when I came to your page and I saw 22,000 followers. I was like, wow, you are creating a huge impact. I mean, 22,000 people getting access to this. I mean, it's so awesome. Well done, Dr. Doris.
Thank you so much. Thank you.
All right.
Okay. All right. So let's hit the ball rolling now. So let's talk more about glaucoma. Can you give us an overview of what the disease is all about?
Okay, glaucoma. The name sounds big, but I have to say that it's a big problem. Really, it's a big problem. It's not something that I think anybody should take for granted. And I think that's the importance of the World Glaucoma Week, which is just around the corner, that people should be enlightened. They should know really what glaucoma is. Okay, so glaucoma is just simply a disease of the optic nerve. And I think I have an eye model here, so I'm going to show us what the optic nerve. So if we look at this now, this is what the eyeball looks like. Okay, so this is the front of the eyeball as we all know it. Now at the back of the eyeball, which is what I'm going to be showing us here, is what we call the optic nerve. Now every information, every image this eye captures must be transmitted through this optic nerve to the brain. Now if there is no transmission of information between the eyes and the brain is going to interpret that I do not see anything. So it's as good as saying everywhere is darkness because there is no transmission of information. So it's almost like how I'll tell people, I liken it to a television. Okay, so we have the television screen. Now, if there is no power cable plugged to electricity, that television screen just shows blank. So it's the same thing that happens with the eye. If there is no transmission of information from the eye to the brain through the optic nerve, which I've just showed us here, the optic nerve, if there's no transmission of that information, and of course the optic nerve is behind the eye, inside, linking the eye to the brain. If that information is not transmitted, the eye does not see anything. Now, glaucoma is a disease that affects that optic nerve. And I usually tell people it's a thief of sight. And I'll explain why it's a thief of sight. Because when the optic nerve is damaged, it doesn't give anybody any sign. The eyes are not red. The eyes are not painful. The eyes are not swollen. Everything that we know that happens to the eyes, we don't see any of it. Everything seems like normal. But yet this optic nerve inside the skull is gradually deteriorating as a result of glaucoma. So what glaucoma really does is that it causes a deterioration, it causes a loss of the optic nerve fibers, and because of that, the information from the eye to the brain stops being transmitted at its end stage, and the person totally turns blind. So that's why people who have glaucoma or who are blind from glaucoma, the eyes look normal, they are rolling left, right, up, down, but the person absolutely sees nothing. Now, why it's called the thief of sight is that when it starts to damage the optic nerve, it's initially it's not obvious to the person who has this glaucoma. So for instance, whenever we see a large field of view, like if you're looking at a human being, you can see the full human being, like from head to toe. Now that is because we have a wide field of view. Now when glaucoma starts to damage the nerve, it starts to damage the nerves from the sides. It doesn't damage it from the center, but from the sides. So it takes it from the outer field of view. So it closes it gradually. I usually tell patients this process can be happening over 10, 15, sometimes even 20 years, gradually closing in the field of view. Now, because your object of attention is always at the center, so like probably you're looking at your phone, you're watching us from your phone, or you're watching us from your computer, your object of attention is your phone, your computer, which is at the center. Now you cannot realize that the sides are closing. And because your object of attention is always at the center, you cannot really tell how much of the side is closing in. Now, most patients get to realize when it has closed in at a point when it has reduced to a point we call tunnel vision. So it means that as you look at a full human being, you probably only see the head. You can't see the rest of the human body. And then you want to look at the waist. You have to take the waist to your object of attention for you to see that. Now, that is when most people notice there's a problem. And unfortunately, by the time it gets to that point, it is actually too late. Most times, even with treatment, the person eventually still loses that small vision level because already what is left is too fragile, is too little. That's actually what happens in glaucoma. And the most times there is no symptom, redness. Most times, like 80 to that is the case. That is what we call primary open angle glaucoma. So most times, because there is no symptoms, people are not even aware that they have glaucoma, and that is the sad part of it. Many people are not aware that they have glaucoma, and that's why we always tell people, whether you have any problem with your eyesight or not, whether you have any pain in whether your eyes are red or not, just visit an eye doctor, visit an optometrist, visit an ophthalmologist, have your eyes examined. It's only an eye doctor that can look inside your eye. Now, I'll just show. So this is the eye again. Now, if I open this up, when we use our instruments, we can actually see to the back of the eye, the beginning of where this optic nerve starts. And when we look at the inside, we can actually tell that one is having signs of glaucoma or does not have any sign of glaucoma. And then usually we would recommend further tests. We could say, okay, you need to do a nerve fiber layer analysis. You need to do a visual field analysis. And the tests will recommend you need to do pressure tests and all of that. So it's at that point that we'll say, oh, this person is a glaucoma suspect. We need to do further tests to confirm if this person has glaucoma or not. So like I said, so if you've not had your eyes examined before, I mean, immediately after this program, you should be booking an appointment with your eye care online, Mistro, or wherever you are. She will direct you somewhere. She will tell you where you can go to, you know. Just have your eyes examined. It's only an eye doctor that can see inside your eye and know when you're having glaucoma at the early stages, when you're not even aware that anything is happening. So usually when there is glaucoma in the eyes, one of the first signs usually will be that the pressure in the eye will be higher than normal. So that's why one of the first things the doctor will do is when they've seen the signs at the back of the eye, the doctor will say, oh, we need to check your eye pressure. So when they check the eye pressure, most times the pressure is high. But there are also some times that people have glaucoma and the pressure is not high. At that point, we call it normal tension or normal pressure glaucoma. So that is something that is also very common as well. But the truth is, it takes your eye doctor looking at all of these things to be able to tell you that you have glaucoma, you're a glaucoma suspect, and
sorry. What happened? Come on now. We're just, come on. Okay, I have to bring them back again. I have to bring him back again. Dr. Edidiong, where are you? I need you back again. Okay. Okay, yes. Where is the request? I'm trying to find your request. Sorry. I'm trying to find the okay, so I'm trying to bring him back now. I think
okay.
Okay, yes, he has joined. Okay, so what?
Okay, I'm back now, right?
Yes, you're back. You know, there was that was on Thursday last week. Yes, on Thursday, a young lady of about 37 years old, and when she came, she told me that she does this computer center, so she uses computer a lot. So according to her, that 2 weeks ago, she opened her computer, went to her work, and realized that she can no longer see the stuff, and everything was just blurred. So she now had to schedule for me to see her. So when she now came, that was her complaint, that she can't see her system. So when we checked, her VA, like how far or how well she see, I realized that the left eye, she wasn't even seeing much. She could just see the first 2 lines, while the right eye, she could see more than half, around 6-9, right? So me, I was looking at her. She's 37, and why is she? Because I was initially, when she came and she said she wasn't seeing, I assumed early presbyopia, like her Bible, 37, her work and all that. Check the back of this lady's eye. She was almost like 0.8, 0.9. She has had glaucoma for some time, for many years, and she never knew. So what brought her, according to her, simply that she cannot see her device, her system. So she actually came to get a blue cut lens, thinking that that's the problem. So imagine when I now started editing her, telling her about glaucoma, and she was telling me that she didn't feel anything, that there was nothing, no sign, that all she knew was she just couldn't look at her device again. So for me to tell her this, she had never been to an eye clinic before. So what I'm trying to say is that trying to elaborate the fact that there is no sign. Like this lady has been like this for more than 10, and what brought her was she can't read. Only for her to be told that the vision in the right and the left eye can no longer be reversed. So now let's talk about that irreversibility of blindness and all that. So using your eye model, because that's when I tell patients that you can't reverse the blindness, they will start citing blindness. What if we do surgery? What if we use eye drop? Do you understand? Can you throw more light on that, please?
Okay, so yes, I'll talk about this now. So you just mentioned a 37-year-old. I'll tell you about a 24-year-old copper whose father has had glaucoma for close to 30, 40 years. The father had been managing his glaucoma, and the father was still seeing well because he had been going to the eye, he's been visiting his eye doctor almost on a monthly basis, monitoring his eye pressure. He was, taking drugs, doing everything to make sure that he didn't lose his sight from glaucoma. Now, the mistake he made was he did not tell his children to check the eyes. Because normally, glaucoma again is hereditary. He didn't tell his children, but two of them, fortunately, were also checking their eyes and they were treating for glaucoma. But his last born, because this man was in his 70s, his last born was 24-year-old. He was a copper at the time. And he just was having his bath and soap entered one eye. I noticed that he's washing off the soap from the eye and the other eye is open, but seeing nothing. That was the first time he was afraid. He said, what happened? So, so they rushed, the father called and they rushed to the clinic. And when we checked, we noticed that that eye that was open and seeing nothing, not the eye soap entered though, was totally blind from glaucoma. And now this eye that soap entered had glaucoma and was very well advanced. Now, I'd explained earlier that the glaucoma affects the nerve, which is at the back of the eye. So imagine where this nerve is, somewhere inside the skull here. First and foremost, there is no kind of surgery you can do to penetrate that part of the eye. I mean, that part of the skull or the brain. You can't get there. You can't do anything to repair it. So once it's gone, it's gone. There is no technology yet to even do a nerve transplant. Nobody has ever done a nerve transplant before. Probably a nerve transplant, if it was possible, would have reversed the blindness. So it's like that nerve is damaged and nobody can have access to it. Before you get access to it, you've damaged the whole eye self. So nobody can have access to it. Nobody can do it. No eye drop. Nothing can reverse a damage that is totally done to the nerve. So usually, the treatment is to prevent it from getting to that point. And that's why the treatment is usually not a one-off. And that's why when we talk about glaucoma, we say we manage glaucoma. We don't treat glaucoma. There is no drug. There is no surgery that you can use to make glaucoma go. Glaucoma, once it's there for life. So usually you can manage it. So the management is such that we want to prevent you from going blind from the glaucoma. I want to prevent your nerve from being so damaged that you cannot see again. That is all we are doing. And that is why it is usually like a co-management. The patient has to be cooperative. The patient has to also be coming to the clinic frequently so that the doctor keeps evaluating and re-evaluating, giving you eye drops, checking how it's doing and all of that to make sure that, like the story about this man was in his 70s. He's managed glaucoma for over 40 years and he didn't go blind, but his son had never had his eyes examined and he went blind in one eye already. Second eye was so well advanced that he had to do a surgery to prevent the pressure from being so high, and then afterwards he's been on eye drops and all of that. So that is the situation. So now we are just managing one eye to make sure he doesn't lose his sight. Yes.
That's during the radio program on Saturday, I was talking to people that in the course of the glaucoma week, that the best way, one of the things you in the glaucoma week is to know your family history. Now, with this story that you told, the mistake is that the boy didn't know about the family history. Like we doctors, when patients come to our clinics, sorry, before I continue, if you have any question for Dr. Edidiong, today I'm not answering any question. He is. I have some already written down for him. If you have any question, please go ahead and drop your question in the comment section and he will take the questions. Okay. All right. So, and I'll talk about family history now. So now, many people, when they go to the clinic, we always ask them family history. The family have diabetes, hypertension, and all those stuff. Now, some people will tell you the answer is they don't know, but they will tell you they are right because their parents may not have told them, and that is
told them. Yes.
The angle that I try patient education to tell parents, if you have glaucoma, ensure your children are aware of what is going on, because that way they too can protect themselves. Right. So now, having said that, there is this thing like when people come to me in my DM, in my message, and then they tell me that they went to clinic, and then I ask, and they say plenty things that happen, and I ask them, what is the diagnosis? For people that are in this space, they know I always ask that question because I believe that a patient should know what is wrong with him or her.
What's wrong with them?
Now, the problem is that for many of them, like I've had patients that would tell me they gave me an eye drop, but they didn't tell me what is wrong with me. And I tell them, okay, snap the eye drop and send. See anti-glaucoma eye drop. How do you think that we as eye care practitioners, because it means that the person that is in the eye drop don't even understand treating. Some patients I know, but they just want to ask you, right? But there are some that genuinely don't know. So how can we help patients, our people right now? How can we educate them more? How can we improve their knowledge? Because the truth is this: if you don't know, it's not a reason for glaucoma not to affect you. Ignorance is not an excuse when it comes to glaucoma. How can we improve on patient education as practitioners? How can we give patients that room to be able to ask us questions as practitioners? Yes. So what do you have to say?
Well, I think so the answer, I think the answer to the question is already what you are doing. You are creating a lot of education out there. You want people to know about all these things. And I think the more patients listen to people like you, like people like me, talk about these things, the more bold they become to even ask their doctors, what is wrong with me? Because now they've heard things they've never heard before. So they know that anything could be wrong with them. So now they are like, so what is this eye drop for? What is wrong with me? And the doctor will always explain when a question is asked. So I think, yes, some doctors may not have the habit of explaining to their patients, but I think if the patients also ask the questions, the doctors will they don't have any obligation but to answer.
Yes, but what I want to know, what is the marginal experience when it comes to patient education? That's where I'm
education. Okay. So experience. So at Magna Eye Care, one of the things we don't take for granted is patient education.
Great.
Even while we are performing tests on you, we are telling you this test is because of this and this and this. We have seen such and such in your eye. We want to do tests to confirm if this is in your eye or that is in your eye. You understand? And sometimes we'll even tell them, have you ever heard of a word called glaucoma before? Like, I think I used to hear my mother say she used to go to one general hospital in the East. They said they are treating her for glaucoma. I said, okay, I'm seeing signs of it. I don't say, God forbid. I said, no, I'm telling you what I am seeing. So we have to look at it. So by the time we do the test, by the time we do the visual field, the good thing is the visual field test usually has a printout and they see the result for themselves. And we tell them, this result is showing us that this and this and this is wrong at your nerves at such and such a point. Now, at that point, there is evidence. You understand? So usually we try to practice evidence-based medicine, if I should say. So by the time we print out results and show you, you understand, we do fundus imaging and show you that this is what is normal and this is what is in your eye. The patient knows that this thing is for real and they cooperate. And I must say that once patients are properly educated, their cooperation level is high level. I mean, I have patients who will tell me, when is my next appointment? I tell them maybe 6th of March. 6th of March, they are available because they want to, and they are following up so well that I'm like, wow, this is the importance of proper patient education. When they know what you are doing and when they know what you are doing and what your plans are, the things you intend to do. So I tell them, okay, so your pressure is in this. This is your pressure. It should be in this level. So we are going to be checking the pressure so when they come, they want to know what the pressure is. And by the time they see that it's working, the pressure is getting better. In fact, some will even tell me, I've even noticed my vision has even improved since the pressure came down. They become very happy. So usually, but explaining these things to them is what makes them also cooperate and what makes them see that the line of treatment is making sense too. You understand? So there are a couple of other tests there are a couple of other risk factors for glaucoma. People who are short-sighted, I mean, they must screen for glaucoma. If you know you cannot see far, is important. If you are 40 and above, you must screen for glaucoma. If you're a black person, and I know that majority of us watching this are black people are at a higher risk of having glaucoma. I've seen several patients who tell me, but I checked my eyes abroad and they didn't tell me I have glaucoma. I usually tell them, for doctors abroad, diagnosing glaucoma is almost like how difficult it is for a doctor abroad to diagnose malaria. I mean, malaria, as common as it is to us, is not something they see as often as we see. So even with the patients, by the time you start having some kind of fever, you already can suspect you have glaucoma. I mean, you have malaria. So glaucoma is similar for eye doctors in Africa, because it's something we see so regularly. We can see it most times at the very early stages. We don't have to wait for it to get to the end stage. We will pick it up because it's something we've seen so many times. But abroad, Europeans, Americans, Caucasians generally, they don't have as much glaucoma as Africans. So being African is already a risk factor too. So these are the reasons why, in fact, I think we should champion World Glaucoma Awareness more than even the Oyibo people. And the funny thing is that they are championing it more than us, even when they don't have as much cases as we do. So it's something that we should put in more efforts to do. And that's why I'm really very proud of what you are doing here, creating so much awareness, both on radio, on Facebook, and everywhere. I mean, I'm picking a cue too.
Thank you so much. Thank you. I really appreciate that. So, that's like when I talked about Africans, having higher, prevalence of glaucoma, so somebody in India was like, well, I'm not an African. I looked at him like, you wish, like, for your mind, you're an African. So, but let me ask something, and something that I know that the audience wants to know. Tests, because earlier today when I told you about a piece me up that went and spent online, that they claim your everything. Yes, I've already diagnosed him of having glaucoma, and then only for him to come, the pressure and everything is off the roof. So now there are people that just how do I put it? They will go and meet their neighbor, or go and meet their pastor, or go and meet someone, and they'll tell them you have glaucoma. Like, I know that as a doctor, I cannot look at you and tell you have glaucoma, but there's some people that like all this. So what are the few tests, already 30 minutes, what are the few tests that one can actually do, before we finally arrive at that point that will tell you that you have glaucoma? What do we look out for? And if you can throw in magna experience, also like that.
Okay, all right. So the tests usually that we do, the first thing is we are going to do what we call the fundoscopy. So we are looking at the inside of your eye, looking at the beginning of the optic nerve, which is what runs straight to the brain. So we call that the optic nerve head. So we look at that and we see if it shows signs. Usually, if it is flat and normal, if it is flat, it's normal, there is no excavation, we know that the person doesn't have a sign of glaucoma. But if we see an excavation, usually we can know that this person is having a sign of glaucoma. Usually we also look at how the blood vessels in the eyes are arranged as well. So if there is an excavation and then the blood vessels are in a particular, that go in a particular way, we can tell that this person is having signs of glaucoma. Now, that is not enough, because there are people who also have what we call a physiological cup. That means they were born with their optic nerve looking like that, but it's not because of glaucoma. So for that reason, we'll go straight to check the pressure. So usually we'll check the pressure in the eye, and if the pressure is above normal, we are already 70% sure the person is a glaucoma patient. Pressure is within the norm. We still want to do for that test. A pachymetry test. Are you there? Hello? Are you there? Okay, all right. So when we check the pressure and the pressure falls within the normal range, we'll now do what we call a pachymetry test. So the pachymetry usually will check the thickness of the cornea. Now, the thickness of the cornea, if the yes, the outer part of the eye, yes. So if that front part of the cornea is thin, it usually would give a false low pressure. So we have to recalculate the pressure for what the adjusted should be. So is that recalculation that now lets us know that, okay, this person has what? In fact, I had a patient once who I checked his pressure and his pressure was high. And I still did this corneal thickness test and he had a very thick cornea. And then by the time we calculated the pressure was actually much lower than the original. And we told him that, oh, your pressure was actually high, but we've done the recalculation based on the thickness of your cornea and it is actually lower and almost at the normal range. And he was like, wow, I'm so impressed by this because I always felt I had a high pressure until I went to London and they did this test that you just said. Now I said, no, we are doing it in Nigeria. You understand? So usually that test would help us to be sure that this pressure test we have done is what it should be. Now, if we check it and the pressure is still high, recalculated, we start treating for glaucoma. At least we must give you drops for the pressure to come down, because the truth is, when the pressure in the eye is high, that is what continues to damage the nerves in the eye. Now, if the pressure is normal and we still saw that physiological, then we still saw the excavation in the optic nerve, we will now send you to do, yes, the excavation, we will now send you to do a visual field test. So is that visual field test or even an OCT, which is optical coherence tomography, that will now do like a layering scan of your retina and the optic nerve. Now, when it does that, it now gives us the true picture. If at that point there's no damage, you can say, okay, this excavation is physiological. It is not because of glaucoma. But if at that point we still see something, we will still have to start treating glaucoma. Treatment for glaucoma is the pressure, bringing down the pressure, maintaining the pressure. Usually would also give what we call eye antioxidants to help improve the nerves. Generally, eye antioxidants help the nerves and the retina to be healthy. And then at some point, there's also some formula we give too that helps to increase blood flow to the nerves so that the nerves are also healthier than they should be. And basically, those are the things that we do. But most times, if with all the medication they're not being controlled, usually we'll have to send you to do a surgery. So at that point, you now need to do what we call a glaucoma surgery. But like I always tell people, glaucoma surgery is not to reverse or restore vision. It's to prevent further deterioration or further loss of vision. So that is just basically how we go about it.
Wow. You know what? I love the way you took time to explain the process of diagnosing glaucoma.
Diagnosing glaucoma, yes.
Because I've seen people that will say, my neighbor checked my eye and they say I get glaucoma. And also people will go online and they're buying all sorts of things because they say drugs. You see, like I tell people that there are series of tests that you go through before we diagnose, unless those people that their own is glaring, like now you take the back of the eye, you are seeing it there. Those ones don't need all those things. Can you still see
all those tests?
Can you see
yes, I'm still with you. Okay. I'm still with you. Yes.
Okay. So I love the way you took time to actually explain that. And then another thing that it did for me, that it makes me more confident of my patients that come to Magna. I mean, I know you are there in there. What do I have you guys there? No, really. So I'm proud. So I have a question here, right? And this question is, although I think you've answered it, but I think the person may need, because is this one person that I've tried to talk with her a couple of times on this page, and she keeps asking this question over and over and over. Now, in her own case, let me just give you a background. She insisted that nobody in her family had glaucoma. Are you there? Okay, so she's
I'm with you.
Glaucoma. So she kept telling me, how did I develop glaucoma? I don't know where she was diagnosed of glaucoma, but she said she was diagnosed of glaucoma and she was placed on medication. So her question is this: she's so sure that nobody in her family has glaucoma.
Has glaucoma.
Yes.
So how did she develop glaucoma?
So in the answer that, I want you to also tell us other ways aside from being an African and aside from family history. Do you understand? Are there other ways that can actually lead to glaucoma, so that we can hurry up?
Okay.
40 minutes.
All right. Okay. So one of the things could be, it could actually have been trauma, if there was trauma that affected the. Okay. So usually when the pressure, one of the things that causes the pressure in the eye to one of the things that causes the pressure in the eye to go high and cause glaucoma is when there is a closure of what we call the trabecular meshwork. Now, several things can lead to the closure of that meshwork. So this is how I describe it. Inside the eye, there's always fluid in the eye. This fluid, new fluid is always continuously being produced, and the old fluid is always continuously draining out while new one is being produced. Now, if the rate of production of new fluid is too high, it will, as against the rate of drainage, it will cause the pressure in the eye to go up, and the person will have glaucoma. Okay, so sometimes different metabolic reasons could lead to the rate of production being too high. Sometimes people even take certain drugs that over time, even people that smoke a lot, it could lead to glaucoma. Yes, so people take drugs over a long time, or certain habits they have that even just makes that meshwork to start to close up. Or sometimes it may even just be an inflammation the person had, and then certain cells were emitted during the inflammation that blocked the drainage of fluid out of the eye. The pressure will start to build up because fluid is not draining out the way it's supposed to. It will still develop into glaucoma. And then also, I always tell people, you know, the genes, or I would say, that causes glaucoma eventually is more of a recessive gene. So sometimes it could skip several generations and express in a great-grandchild, and the person may not even know that the great-grandfather had glaucoma. So these are different ways or scenarios that could have made someone have glaucoma, and the person may not be able to directly trace it to their family. If the great-grandfather had glaucoma, the person will not know, because the great-grandfather is already probably late long ago, and they may not have known that, they may not have known any story. They may not have even been able to diagnose glaucoma at that time. You know, so these are some of the things that I tell people. And there are some, yes. So it could have skipped 2 generations and still express itself. That happens many times. So for that reason, I would say that so many things can lead to it. But if your doctor has examined your eye, has run tests, and says that there is glaucoma, please, no matter what, do not take it for granted. No person should take it for granted.
And then also, I think diseases such as all this hypertension, diabetes, I think they're also risk factors to a type of glaucoma.
Yes, that's another thing. Yes, diabetic complication, hypertensive complication, those all lead to glaucoma as well. Yes, because like diabetes usually would cause production of new blood vessels, new vascularization that also block the same drainage system, and it leads to glaucoma as well. So these are all complications that that happen as well. So many things are involved, really, so many things. So for this particular person, it needs a proper examination to know why this particular person is having. But if this person's doctor has confirmed it, the person shouldn't take it for granted.
Well, I spoke with her, but I hope that I think she's at work now, so I hope that she gets to watch this. You see, Dr. Edidiong, I told you that we'll be here for over 40 minutes, and you told me no, 20 minutes. You see, the thing about glaucoma is that glaucoma is broad, you know, and what we just did now is not even up to like 1/5 of how glaucoma of the whole thing. But what I love is the fact that you talked about the disease, you talked about the management, and then you did your best to debunk that whole cure, you know, the whole stuff, you know, because I keep telling patients that or people that there is no cure for glaucoma. What you do is you manage it, and then this management also has will I call it has a comma. The management is best when it is caught early. If you catch it too late, if it's anything anybody can do.
Yes.
Dr. Edidiong, I know you've been in the clinic this morning because of this. Thank you so much. So I'm going to release you, okay, so that, but just be assured that one day I may call you up very soon again, because I love what
no problem.
And before you run away, I want to say thank you for what you're doing in the city of Abuja. I hear about what you and Imi are doing. I am super proud of you guys. And yes, I miss you guys here in Akwa Ibom, but I'm happy that I have a place to come to in Abuja. Come to Abuja.
Yes, yes,
So
you're always welcome anytime.
so I love what both of you are doing. So I'm going to put in a clip of this on Instagram. I'm going to do my best to tag. I've not seen you on Instagram. I only see Magna. I'm going to be tagging Magna too.
Magna
Are you on
Ike
Instagram?
on Instagram.
Are you on? Are you
I am, but I'm not active.
on?
I am, but I'm not active.
So I'm going to do my best to tag you guys because I really want the an eye care online audience when they are looking
Mm,
for an eye clinic. Let them know that Magna
Nick
is there for them.
is there.
Magna is there to take care of them, and I'll be rest assured that they are well taken care of. So thank you so much for
Mm.
doing this with me. I
Thank you so
really,
much to
really
Dr.
enjoy talking with
Doris.
you. Yeah, so
All
let me
right.
hand you.
Have a
Yeah.
wonderful
Thank
evening
you.
and good night
Good
to
night.
everyone.
Good night.
Bye. Okay.
Bye. Mm, okay. Okay. Okay, everybody. Thank you so much. That was Dr. Edidiong Udom. Like, I am so happy that he agreed to do this with me. Glaucoma is such a broad topic. It's and apart I call it a deadly disease because, like he said, he's a thief of sight. It's actually a silent thief of sight. I shared a story about a 37-year-old patient that I had that didn't know that she had lost her vision, on one eye. And he shared the story about 20-something-year-old that he also had that, of course, that also lost his vision to glaucoma. Next week is, I forgot to ask Dr. Didi on what plans they have for Glaucoma Week next week, but I believe that he can drop that in the comment section or let me know and I will share with you guys. Next week is Glaucoma Week. Many eye clinics all over the country are offering free glaucoma screening to many people, and some are offering a discounted price. So please avail yourself of the opportunity to actually get screened this period. Go and get screened. If you are in Akwa Ibom State, NAFDAL's Eye Clinic, the clinic I work with, are offering not just free screening, but also free medication. So if you are in Akwa Ibom and you have glaucoma, we had about 100 bottles available. As of today, it has gone down to 61, maybe 50, something like that. So and today is imagine. So please, if you have or you know someone that has glaucoma, let them come for free screening. If they qualify for the free eye drop, we will give it to them. Maintaining the eye drop, managing glaucoma is expensive. So the best thing you can do is to prevent getting to that point. But if peradventure you already have glaucoma, start taking medication on time because glaucoma itself may not be avoidable, but the blindness can be. It's important. Share this news, share this information with your friends. Glaucoma is a deadly disease. It's not something that you can cure, it cannot be reversed. And use the opportunity of this Glaucoma Awareness Month to get screened. If you have any questions and if you want to reach out to Dr. Edidiong Udom, the address is in the first comment in the comment section. He is in Abuja. Him and his lovely wife, who is also my friend, they are in Abuja, and they will take good care of you. If you visit them, just tell them that you are from Dr. Doris SAS or from Eye Care Online. Whichever one, they are partners and they will take very good care of you. So tell your friends about Magna Eye Clinic. Tell them that we have a branch there. So it doesn't have to be, I have to come there or you have to come to a fire bomb. They are very good at what they do. Next month, we'll be having another guest that will be taking us through another issue, another disease in the eye. And then he is from Kano. So if you have your Kano people, tell them to get ready for next month, where we'll be playing host to another amazing doctor who will be taking us a different part or a different issue in the eye. Your eye health is my passion, and I'll do the best I can to share with you the right information that will help you preserve your vision. What I need you to do is to follow the instruction, share the information, because together we can actually reduce the prevalence of avoidable blindness. Let's have a good night rest. Good night.